So I'm Aleksandr Lazaryan. I'm the associate professor at the Department of Blood and Marrow Transplant and Cellular Immunotherapy at the Moffitt Cancer Center, a research institute in Tampa, Florida. I'm also an associate professor of oncologic sciences at the University of South Florida. My research is focused on immunotherapies and their complications, such as chronic graft-versus-host disease. So chronic graft-versus-host disease, as a brief introduction, is the leading cause of morbidity and mortality and disability following allogeneic stem cell transplantation. It is an immune-mediated disorder that has inflammatory and fibrotic components, and it's characterized by dysregulated immune homeostasis, leading to overproduction of inflammatory cytokines such as IL-17, IL-21. At the same time, there's been decrease and reduction in the recipient regulatory T cell that gets the immune system off the balance. So Rho-associated coiled-coil kinase, or ROCK, plays an important role in inflammation and fibrosis by regulating fibrotic mechanisms. And belumosudil is the newly approved FDA drug that is an oral ROCK2 inhibitor. In the murine model, belumosudil was demonstrated to regulate inflammatory STAT3 pathway responsible for IL-17 and inflammatory IL-21 production, and also increases the tolerogenic STAT pathway through the upregulation of regulatory T cell. So based on the compelling preclinical data, we conducted the initial phase 2A KD025-208 trial that was published last year in JCO that enrolled 54 patients across 7 US centers in 3 dose-specific cohorts, 200 milligram once a day, twice a day, and 400 milligram once a day dose. Among the patients who have received 1 to 3 prior lines of therapy for their steroid-refractory chronic graft-versus-host disease. So this trial actually demonstrated good efficacy and safety profile of this drug, and subsequently led to the ROCKstar KD025-213 trial. That was a randomized trial that was testing 200 milligram daily dose versus twice a day dose. And the results of this trial were published in Blood last year, and ultimately led overall to the FDA approval of belumosudil among patients with steroid-refractory graft-versus-host disease who have failed at least 2 prior lines of therapy. And these are adults and pediatric patients over age of 12. So because both of these trials, they were focusing certainly on overall response rate as a primary endpoint, there was an endpoint that was marked as a secondary endpoint called failure-free survival. And for our ASH presentation in 2021, we specifically targeted failure-free survival as a primary endpoint, and we combined the data from 208 and 213 clinical trial. Just because we felt that there's been limited data from contemporaneous prospective clinical trials on failure-free survival. And just as an introduction, failure-free survival has been really established as a very important endpoint in chronic GvHD research. It reflects the composite indicator for treatment success. Basically, it incorporates the composite endpoint of recurrent malignancy, non-relapse mortality, and the absence of subsequent need for chronic GvHD therapy. So historic rates of FFS, they've been reported in observational large studies in the past, and they were estimated to be around 56% at 6 months, 45% at 12 months, and 31% at 24 months. So we aimed at assessing the failure-free survival from the combined ROCKstar trial and 208 trial, where we enrolled a total of 186 patients. And this was a pretty advanced patient population with chronic graft-versus-host disease, as 70% of the patients had severe chronic GvHD, 52% had more than 4 organs involved, and 37% received more than 3 prior lines of therapy. So what we found is that in overall combined analysis, first of all, the median failure-free survival was 14 months, and the rates of FFS at 6 months were 75%. There were 54% at 12 months and 38% at 24 months, comparing favorably to historical benchmarks. The major reason for failure-free survival as an outcome was the failure to achieve the new line therapy free endpoint. So the need for subsequent line of therapy was the primary contributor to the failure-free survival in our analysis. This was also the first time when we tried to analyze prognostic factors that were associated with increased failure-free survival. And in our cohort, in both univariate and multivariate analysis, we found that progressive onset of chronic graft-versus-host disease, steroid-free upfront therapy for chronic GvHD, as well as more than 2 or more prior lines of therapy for systemic disease were all associated with increased hazard ratios for failure-free survival in a range from 2 to 3 in their magnitude. So altogether, this was a contributory analysis, to delineate and get some more insights into what are the failure-free survival estimates with one of the major chronic GvHD FDA-approved drugs within the past year. And certainly, this was an opportunity to model and get some insights into what might be predictors of FFS. I mean, certainly, just to add, the field of chronic graft-versus-host disease is changing rapidly, and now we've got 3 drugs that have been FDA approved, including belumosudil, ibrutinib, and ruxolitinib in advanced steroid refractory setting. And certainly, future studies will aim at gaining more perspective into possible combination therapies or insights into the sequential use of these drugs to achieve better responses in our patients.